session for just a small mini session to cover the very important and a very basic topic that we call as urodynamics. Yeah, definitely I'll be taking this frequent surprise sessions. We'll be covering all the urodynamics session, but today I've just taken a small part of it. That is the basically the uroflowmetry and the cystometry. So let's start. So first of all, what do we mean by the following terms? That is the stress incontinence. Stress incontinence means that is involuntary leakage of urine on effort, exertion, which may be either coughing or sneezing. Now, what is urge incontinence? It is the involuntary leakage of urine which is accompanied or preceded by urgency. Now, what do we mean by urgency? It means a sudden compelling desire to urinate that is difficult to delay. That means there will always be leakage of urine along. It may be accompanied or it may be preceded by urgency, which is a sudden desire to urinate and which is very difficult to delay. Now we have another type of incontinence that we call as mixed incontinence. What happens in mixed incontinence? There will be symptoms of stress incontinence that we just discussed above. That is, there will be leakage of urine on effort or exertion, that is like coughing or sneezing. Along with that, there will be urgency with it. So now let's see what's the definition of it. It's involuntary leakage of urine, which is associated with both urgency and exertion on effort, sneezing or coughing. Now, what is overactive bladder? It is urgency. It is defined as urgency that occurs with or without urgency incontinence, and usually it is associated with frequency and nocturia. Sometimes overactive bladder that occurs with incontinence is called as overactive bladder wet. But when it occurs without incontinence, it is called as overactive bladder dry. Am I clear for you? All the four definitions are clear for you, all of you? Because they will be helping us to study the graphs of urodynamic.
Yes, ma'am.
Yeah, thank you for that. And the most common type of incontinence is a stress incontinence. Okay. Now, what is the definition of urodynamics basically? What does it means? These are the series of tests which are conducted in an outpatient setting that evaluates the function of the bladder and the urethra in relation to the storing and releasing urine, that is the filling and the voiding phase. Now, urodynamics, it is divided into cystometry and uroflowmetry. Cystometry test includes, it is the amount of urine in the bladder which can hold and the urge when to pass the urine. Now, what is uroflowmetry? It is the measurement of urine speed and the volume of the urine. So I'll be just repeating what urodynamics is. It's basically a test which is done in an OPD basis that evaluates, that checks the function of the bladder and urethra in relation to whether the bladder is able to store and the urethra is able to release the urine. That is, we divide the maturation cycle into filling and the voiding phase that we are going to discuss in the next few slides. Now, urodynamics, it is basically divided into two types, that is cystometry and uroflowmetry. Cystometry is done to check the amount the bladder can hold the urine and when is the urge to pass the urine. Now, what is uroflowmetry? It is the measurement that how much the urine flows with the speed and what is the volume of the urine that flows. That is defined as uroflowmetry. Hope I am clear to all of you till now.
Yes, ma'am.
Now, why do we do urodynamics? The importance or the indications of urodynamics are, they help us to explain the symptoms like incontinence, frequency, and the recurrent urinary tract infection. It is also recommended after conservative measures have failed and before the surgery for urinary incontinence if we have a clinical suspicion of detrusor overactivity or there is previous continence or prolapse surgery, or there are symptoms which are suggestive of voiding dysfunction. Now, in terms of indications, we do, first of all, in terms of we have incontinence. According to the type of incontinence, we will be dealing with the conservative management. If those conservative management fail, or patient has any surgery previously done for incontinence or a prolapse surgery, and she has again come back with the symptoms of incontinence, or she is still having this, we have high suspicions that she is having detrusor overactivity. So these are the indications in which we will do urodynamics. Now, before doing urodynamics, we need to understand what are the prerequisites to perform the urodynamics. First of all, from the patient, we need to ask about the history of urinary tract infection. In terms of, by asking her, we will be asking her about frequency, urgency, dysuria, or any lower abdominal pain. And still, if we have suspicious, we are going to do urine DR. And if it's still needed, if we have any infection comes out in urine DR, we need to do urine culture as well. If patient does not have urinary tract infection, then she will be able to undergo urodynamics. If she has an infection, then we need to treat that infection first and then go ahead with the urodynamics. Or we also need to ask in the history of the patient about the drugs, what type of drugs she is using, if she is using any antimuscarinic drugs or she is using any diuretics. We need to stop these drugs because she cannot undergo then the urodynamics procedure. And other thing is that we need to inform the patient, we need to explain the procedure to the patient, that what are we going to do with her. And very important, we need to maintain the patient's dignity and respect of the patient. It's very important because we are going to do a test that is, she's a very sensitive issue. We are going to deal with the woman, that is incontinence, which needs to be dealt very sensitively with a woman. Yes, sorry for the interruption. Yes. So now, so just I'll very quickly revise it. Now, what we have studied till so far, we have studied the types of incontinence that we are having. And the most common type of, we have stress incontinence, we have urge incontinence, we have overactive bladder, and we have mixed incontinence. The most common type among them is the stress incontinence. Then we started what is the definition of urodynamics. It's basically a test which is conducted in OPD patients to evaluate the function of the bladder and urethra in relation to the storing and releasing urine. It is further divided into two types, that is cystometry and uroflowmetry. Cystometry checks the amount of urine bladder the bladder can hold and when is the urge to desire or the desire to pass urine. Uroflowmetry, it tells us about the flow of the urine speed and the volume in the urodynamics. Now the indications, why do we perform it? We perform it to explain the symptoms of incontinence, having frequency or recurrent urinary tract infection. It is recommended to do the procedure when there is any clinical suspicions of having detrusor overactivity, there is any previous incontinence or a prolapse surgery was done that was failed and patient has again come to us with symptoms of urinary incontinence, or we are suspecting your patient is having symptoms suggestive of voiding dysfunction. Now, in terms of prerequisite, we need to explain the procedure to the patient. We need to maintain her dignity and respect of the patient. In history, we need to ask from her about the symptoms of urinary tract infection. And if there is any infection, we need to treat that infection. And also we need to take the history about the drugs, especially the drugs, about the diuretics and the antimuscarinic drugs. Now, how would we proceed ahead with the how to do urodynamics? It's not the part of the exam that how do we, in the exam, you will never be asked like how to perform urodynamics. But it's very important that when we do the next few slides, the graphs of the urodynamics to understand how we go ahead with it. So as you can see, this is the patient who's sitting. She is sitting on a chair. This is the chair in which the urine amount of urine will be measured from her down below. And this is the system. This is the machine of the urodynamics. And this is the fluid that is going. It is running into. Will be running into the catheter for her. Now we can see. This is the uterus. This is the bladder, and this is the rectum. So first, what if the idea, the why do we do this test is basically we need to check, we need to reproduce or repeat the same micturating cycle, that is filling of the bladder and asking the woman to void, in which and these are the transducers, that is the which are going to measure the pressure of the bladder in the bladder, and this is going to measure the pressure of the in the vagina. So in the bladder pressure, we need to check the amount she's having. We'll be passing a transducer into it, which is going to measure the pressure of the bladder pressure. And in the vagina, this is going to measure the pressure of the abdominal pressure. Now, the vaginal pressure catheter, it can either be placed in the vagina or in the rectum as well to measure the pressure of the abdomen. And once we subtract the pressure from the vesical pressure and the abdominal pressure, we get the detrusor pressure. How do we perform it? We ask the woman, as we can take the example of this woman, she is sitting on the flow meter. So we ask the woman to sit on the chair, and then we insert the catheter into it and fill the bladder. But before filling the bladder, we need to check what is the amount of residual urine she has passed. Or by we can do an ultrasound for that to measure the residual amount of urine. Now, these are the two, and then once she has passed the urine, the transducers, that is the two pressure catheters, will be inserted one into the bladder and one into the either vagina or the rectum to measure the pressure of the bladder, abdominal, and the bladder pressure or vesical pressure. We are going to insert this, and then the detrusor pressure will be calculated by subtracting or minusing, that is the abdominal, from the vesical pressure. Now, as you can see, this is the fluid that is it is usually normal saline, which is the lukewarm normal saline, which is started at a rate of 10 to 100 ml per minute. While now it has been started, this normal saline will be started for her, and pressures will be measured. The people going to start measuring the pressure in the vesical pressure and also the abdominal pressure at the same time will start to be measured. Now we are going to explain, once she is going to have this, we are going to explain the woman that now this is what we call as the filling phase, because we have started the normal saline. So this is going to be the filling phase of the micturating cycle. Now we'll ask the woman to tell us when she feels the first sensation of urine and when she feels the maximum sensation to pass the urine. And when she says she has the maximum desire to pass the urine, at that point we will stop the cycle. We will stop the normal saline fluid and ask her to perform the activities, like she can be asked to cough, sneeze, put her hands into the cold water, because these are the reflexes that will make her to leak urine. If there's any problem with, or it will cause the detrusor muscle to contract. And if that happens, if the urine starts to leak at that point of time, that will be recorded by these transducers, and this will mark the leakage, that where she is having this leakage. We need to identify that. Now, how do we identify? Now, this in the monitor there will be graphs formed into it. How to study that graph? We are going to learn today. Now, what happens in the filling phase when a person, she is at the filling phase of the bladder at rest? What happens in that? You need to understand there are three pressures that we discussed above. In the previous slide, this is the bladder pressure, the abdominal pressure, and the detrusor pressure. The detrusor pressure is calculated by subtracting the vesical and the abdominal pressure. Now, in a person with a normal detrusor function, the detrusor pressure remains 0 or it rises slightly while collecting urine, even at maximum capacity. So what we expect, as the bladder is filling, the pressure of the bladder will start to rise, and also the pressure of the abdominal pressure will start to rise. But the detrusor pressure will remain 0 at that point of time, because there is no activity supposed to be done by the detrusor muscle to contract. So always in the filling phase, the pressure of the detrusor muscle will either be 0 or it will be slightly raised, even when the bladder is full. But the pressure of the bladder, it will start to slowly and gradually it will increase. Now, this is the same filling phase that we are continuing. Now, patient is asked to cough because she is having the desire to pass the urine. Now, in a person with normal detrusor function, cuffs and other maneuvers are seen as sharp rises and fall with equal transmission to the bladder and abdominal channels. Now, when we've asked the woman to cuff, so it will be seen as a rising curve on the bladder, on the vesical pressure. You can see these two curves. There's a rising pressure, and along with that, when the bladder pressure rises, the pressure of the abdominal muscle also rises. But there's going to be no rise in the pressure of the detrusor muscle when the patient cuffs. The detrusor pressure only rises when in the voiding phase, that we need to understand. Now, coming to the next phase, that is the voiding phase. In a person with normal voiding pattern, the detrusor pressure rises as the bladder contracts to empty. When the bladder will start to contract, when the bladder will get the signals from the brain to contract, at that point, the bladder pressure will start to rise. As we can see from this graph, there's going to be little or no rise in the abdominal pressure during the voiding phase, unless the patient strains. Because now the abdominal muscles don't have to do any work. Now it becomes the activity of the detrusor muscle and the bladder to start working and pass and the woman is able to void. Am I clear for all of you so far?
Yes,
Madam, I have a question. How do we differentiate between bladder and detrusor? Is it not one of the same thing?
Bladder is the vesical pressure and the detrusor is the muscle in the bladder. It's the muscle of the bladder that we call as detrusor. That is the difference between both of them. So when we are going to in the filling phase, the detrusor pressure is supposed to be remain at 0 or it will be rising slightly while the bladder is filling with urine. However, there's going to be rise in the pressure of the bladder and the abdominal pressure. Now, when we come to the filling phase, but when the patient is performing certain maneuvers like she is cuffing in this case, so what happens? The bladder will start to contract and will show a rise. And also in the abdominal curve will also rise at the same point. But there will be no increase in the detrusor muscle pressure. Now, the third phase, when the patient is about to void or she is in the voiding phase of the cycle, then what happens? Now the bladder has to contract to pass the urine. So when the bladder contracts, obviously the bladder muscles that we call are the detrusor muscles. So it also contracts, causing asking the woman to pass the urine. That is why the pressure rises at this point of time also. But in the voiding phase, the abdominal pressure will remain. There will be either it will remain 0 or it will rise a small part of it. There will be a little rise into it. Hope I'm clear till now this much.
Yes, ma'am.
yes, ma'am.
Yeah. So just repetition of this point. Normally, the pressure of the detrusor muscle should be 0 during the filling phase of the micturating cycle. And when any involuntary contractions occur within the filling phase, it is seen as a rise in the vesical pressure in the absence of the rise in the abdominal pressure. Urodynamically, this is called as detrusor overactivity. What happens when we call as overactive bladder? Overactive bladder is a type of incontinence. But when we go to these graphs, we don't call as overactive bladder. We call them as detrusor overactivity that we are going to discuss.
Ma'am, yes, this slide.
Yeah. Look, when the bladder is filling, the pressure of the detrusor muscle should be 0. That we just understood right now. In the bladder, when the bladder is filling, the detrusor muscle pressure should either remain 0 or it should slightly rise. This is the same point that is mentioned here. Normally, the pressure of the detrusor muscle should be 0 during the filling phase of the micturating cycle. Now, whenever there are involuntary contractions because of the patient is having a detrusor overactivity, These contractions occur in the filling phase. It is seen as the rise in the pressure of the vesicle in the absence of a rise in the abdominal pressure. This is we call as detrusor overactivity. I'm going to explain it. It will be more clear to you in the next few slides.
Ma'am, in detrusor
जाओ
bladder, there is both rise.
लाइबा मुझे पेंसिल चाहिए पेंसिल लाइबा मुझे अपना वो ला दे अपना पेंसिल केस
Hello?
Vesical pressure and also the detrusor pressure.
Sorry, I didn't get your question. Can you please repeat it? Hello? Can you please repeat your question?
Okay. Ma'am, I understand that in overactive bladder, both vesical and detrusor pressure rises during filling time.
Yes, you're right.
Okay, both pressures rises. Okay.
Both pressure will rise, but the abdominal pressure will not rise.
Okay, yes. Thank you, I got. Thank you.
Yeah, got it. Okay. So now what is the normal cystometry values? These are the values that we should all be remembering by heart, or we should be mugging it up. So now in the filling phase, what are the normal values? And in the voiding phase, we need to understand. In the filling phase, the residual urine amount volume, it should not be more than 100 ml. And the volume starts to fill from 0. Now, when the patient has the first desire to pass urine, the amount of urine in the bladder will be around 150 to 200 ml. When she has a the strong desire to pass the urine, the amount will be 350 ml. But when she has a maximum desire or the urgency to pass urine, that is 500 ml. And this is this maximum desire to pass urine is also the bladder capacity. So bladder has the capacity to hold the urine around 500, but some of the books, they also say 600. So we can take a estimate value of around 500 to 600 ml. The bladder has the capacity to store urine. Now, when it has the maximum desire, when it reaches to 500 ml, the patient has an urgent desire to pass the urine. And when she doesn't reach to the toilet, she leaks urine. That is incontinence. Now, normally, the pressure of the detrusor muscle rises no more than 15 centimeter of water in the filling phase. So in the filling phase, the detrusor pressure should be less than 15 centimeter of water, and there should be no leaks during various provocative actions. That means when either the patient is coughing, laughing, sneezing, or doing any of the Valsalva maneuver, there should be no leak during the filling phase. But when we come to the voiding phase, the pressure of the detrusor muscle should be no more than 70 centimeter of water. That means in the filling phase, the pressure of the detrusor muscle will be less than 15 centimeter of water, and in the voiding phase, the pressure of the detrusor muscle will be less than 70 centimeter of water. And when the curve is formed on the graph, we'll be seeing that the curve is going to be ideally, the curve should be bell-shaped curve with the urine flow rate should be 15 ml per second with a peak flow rate of more than 15 ml per second. So we can just remember to memorize it. We can remember it like that the residual volume in the bladder, it should be less than 100 ml. And residual volume, how can we measure it? Either by doing an ultrasound or by passing a catheter to the patient. These are the two ways in which we can measure the residual amount of volume. And if the residual amount of volume in the urine is more than 500 ml, that is an indication that we need to admit the patient to the hospital for further workup. Now, the first desire to pass urine is between 150 to 200 ml, and the maximum desire is between 500 to 600 ml. That is also the capacity of the bladder. In the filling phase, the pressure of the detrusor muscle should be less than 15 centimeter of water, and there should be no leaks during the filling phase. Now, when we talk about the voiding phase, the curve of the flowmetry, it will be bell-shaped, and the peak flow rate will be more than 15 ml per second, and the pressure of the detrusor muscle will be less than 70 centimeter of water. Am I clear to you, all of you? Can anyone repeat the values for me?
Yes, ma'am.
The values for me.
Yes, ma'am. I will repeat.
Yeah, sure, please.
Ma'am, residual volume should be less than 100 ml, and we can measure the residual volume either by ultrasound or either by catheterization. Then the first desire is at 150 to 200, and at 350 strong desire, and maximum capacity of the bladder is a 500 ml.
Or 500 to 600, because some of the books say
500 to
600.
600, and detrusal pressure during filling should be no more than 15 centimeter of water, and during voiding the detrusal pressure should be no more than 70 centimeter of mercury. 70 centimeter
Of water.
Yes.
And what is going to be the shape of the curve?
The shape of the curve should be bell, and flow rate is a 15 ml per second.
More than 15 ml per second.
More than 15 ml per second.
Excellent. Yeah. So now when we are going to, now how do we tell? Now how to reach a diagnosis? By reading the curves that whether it is detrusor overactivity, it is urodynamics stress incontinence, or it is sensory urgency. We need to differentiate between three of them. So first, with the detrusor overactivity, now you need to understand one thing. We call incontinence, we call it overactive bladder. But when we go to the curve, we don't call it as overactive bladder. We call them as detrusor overactivity. When it is sent as a patient to a patient, we will call as overactive bladder. But when we speak in terms of the graph or in the terms of urodynamic studies, we need to say it as a detrusor overactivity. Now, when we tell to the patient the diagnosis, we are going to say stress incontinence. But when we read on the graph, we are going to say it as urodynamic stress incontinence. If you say stress incontinence, you will be marked as 0. There are curves, there are graphs in the exam. If you go through the recalls, you will be seeing those graphs frequently. And when you see the graph, you will be seeing two options are very close there, and they will be similar, either stress incontinence or urodynamic stress incontinence. So you need to be very smart in marking them, that whenever the graph is present, your answer will be urodynamic stress incontinence, not a simple stress incontinence. And same way for the overactive bladder.
Ma'am, I want to ask one thing. We are following graphs. That's why we should say urodynamic stress incontinence.
Yes. Yeah. But when we in the exam, when we are solving the questions in so much confusion and stress level, sometimes the options are so close by, like stress incontinence and urodynamic stress incontinence. We just randomly mark by mistake. We don't have that intention, but sometimes we do it. So, we need to be very open-minded and clear at that mind that if the graph is there, we need to mark it as urodynamic stress incontinence. And if it is overactive bladder, so in terms of the graph, we are going to mark it as detrusor overactivity. It's never going to be overactive bladder when it comes to the graph. Now, how do we define them? If it is going to be detrusor overactivity with incontinence, there's going to be rise in the detrusor muscle pressure and the vesical pressure. There may be leak or there may not be leak. Detrusor overactive bladder, that is wet, and detrusor overactive bladder, that is dry. So in detrusor overactivity or overactive bladder, there is going to be rise in the detrusor pressure of the detrusor muscle and pressure of the vesicle in the filling phase. That is very important. You need to see the graph, that what phase of the graph it is. Either it is the filling phase or the voiding phase. If the pressure rises, if the pressure of the bladder, vesical pressure and the detrusor pressure, it rises in the voiding phase, this is not going to be detrusor overactivity. You need to check that which phase of the graph you are studying. Now, when it comes to the urodynamic stress incontinence, there is going to be rise in the abdominal pressure and the vesical pressure, that is the bladder pressure, and there will always be leak. In a stress, in urodynamic stress incontinence, there is leak is supposed to be there. With the leak, plus there will be rise in the abdominal pressure and the vesical pressure as well. Now, when there is detrusor overactivity and there is sensory urgency or sensation of urgency, so it is going to be the same like detrusor overactivity with incontinence. That is rise in the detrusor pressure and the vesical pressure, but there will be sensation of urgency or the bladder capacity is reduced. Whenever there's going to be sensory urgency, you just have a single hint from the question that the capacity of the bladder is reduced. From 500, it could be the normal capacity of the bladder is between 500 to 600. If the bladder capacity decreases by this, then you mean it is understood by you that it is going to be sensory urgency. It's going to be the same rise in the pressure of the detrusor muscle, rise in the pressure of the vesical pressure, along with that sensation of urgency, or there can be decrease in the bladder capacity. Is this slide clear to all of you?
Yes, ma'am.
Yes, ma'am.
Thank you. Let's move ahead. Yeah. Now these are the graphs that we need to study. First of all, we are going to study the normal response. Now you need to see whenever this graph is there, you need to see this P abdominal. This is the pressure of the abdominal. This is the pressure of the vesicle. That is the bladder pressure in which the bladder catheter has been inserted. Now this is the detrusor muscle pressure. And this is the flow rate. And in the flow rate, you're going to see the curve as bell-shaped. Now we are going to, first of all, we are going to see the normal response of the bladder. In the filling phase, the bladder pressure is started to rising. When the patient coughs, the pressure rises very high, and then it comes again back to the bladder is filling again. Again, when she performs a Valsalva maneuver, the pressure rises, and then it comes back down. That is, the bladder is started to fill back again in the same way. And we see that the pressure of the vesicle, it has slowly started to rise. With the cough, there was also increase in the pressure of the bladder as well. With the Valsalva maneuver, there was increase in the pressure of the bladder. But when we come to the detrusor muscle, we cannot see that there was no any rise in the pressure of the detrusor muscle. Only there was a slightly rise. This slightly rise in the detrusor pressure during the filling phase is normal. So you don't need to worry with that. And when the bladder is filling, the flow rate is continuous. We can see that it's continuous. The straight line is there. Now, when we come to the detrusor overactivity, that is overactive bladder. If we talk in our normal terms, we call it overactive bladder. So we are going to see in the overactive bladder that the pressure of the abdominal pressure will remain the same, steady throughout the filling phase, but the pressure of the vesicle, that is the bladder pressure, has started to rise. Along with that, we can also see that the detrusor activity has also started. And you can also see that there is a leak visualized. The arrow says that there is a leak visualized. That means in the detrusor overactivity, there's going to be rise in the vesical pressure and also the detrusor muscle pressure in the filling phase. Are you all clear till now?
Yes, ma'am.
Yes,
Yes.
ma'am.
So now the urodynamic stress incontinence, we need to understand this. Now in the abdominal pressure, in the stress incontinence, we told before that the pressure of the abdominal muscle is going to rise in the filling phase. That is when the patient performs any cough. So pressure is rising. At the same time, we can see that the pressure is rising in the bladder also. That is the vesical pressure. But there is going to be no rise in the detrusor muscle. There's going to be no rise in the abdomen, in the detrusor pressure. This is small pressure. These are small curve. These are small slight rise in the pressure. This is something normal. And you can see that the graph says that there's a leak visualized.
Leak visualized. Yes.
So it means that is this urodynamic stress incontinence. Rise in the pressure of the abdomen and also the bladder pressure with leak in the urine in the urodynamic stress incontinence. Now, when we talk about normal voiding, patient is a totally normal patient that we are talking about. So there will be slightly increase in the rise of the abdominal pressure because the bladder is filling with the urine. The pressure will also be rising. The vesical pressure will also be rising slowly and gradually. The detrusor pressure will be rising. And the peak flow rate curve it's the bell-shaped curve. So we need to just remember two things from this graph. That when we have a urodynamic stress incontinence, there's going to be a rise in the abdominal pressure and the vesical pressure with a leak of urine. And when it is detrusor overactivity, there's going to be rise in the vesical pressure and the detrusor pressure in the filling phase. Although it is written on the top that it is a urodynamic stress incontinence.
Yes, ma'am.
If someone can read this graph for me, please. Is it clear for you to read? Is it?
It's not clear.
The graph
No, it's not
shows,
clear.
It's not clear. The first column, na, it's not clear.
Cannot read what is
First column is not which pressure.
Okay, I'm going to tell you that this number one, where number one is written, it is the detrusor pressure. This is the vesical pressure, and this is the abdominal pressure.
okay, the pink one is the detrusor pressure, the blue line is the vesical pressure, and the red one is the abdominal pressure.
Yeah. So then,
And when there is cough, the P abdominal as well as P vesical is increased, and there is concomitant leak.
yes.
Throughout
That
the
is
graph,
the-
the P detrusor is normal. It's constant. So there is no detrusor overactivity.
That is why we are labeling this patient as
Urodynamic stress
overactive
incontinence.
bladder?
No, urodynamic stress incontinence.
Stress
Yes.
incontinence, because with
Yes.
cough the patient leaks.
Yeah, exactly. Excellent. Yeah, now we've understood it very clearly that whenever there's going to be cough, and we can also see that there's a rise in the abdominal pressure, that is the red line, and also there's a rise in the vesical pressure. Along with that, there's a leak. It mentions in the graph that there's a leak along with the cough. That means it is urodynamic stress incontinence. Okay. So you're going to move the next graph.
Yes, ma'am.
Yeah. So who is going to read this graph first?
Ma'am, can you show the previous graph once again?
Yes, please. Yeah.
Ma'am, that blue column represents leak, right?
This
The
one?
vertical line represents, the blue vertical lines represent the leak, is it?
It's not necessary that blue line will always represent the leak or not, because that is the present, like any color can represent anything. That is going to depend on the question only.
Yeah, I'm asking in this particular graph, does this only if they have marked it as leak, is it a leak, or that vertical lines everywhere representing the leak? In that case,
No, it's only in this question. It's only for this question. It's for only this graph.
Okay. There we can see five such lines. That's what I'm asking. Is that all leak or?
No, that is just a that is just a picture, that is just the image that I have taken it. It's going to be different for every other image that is going to be there.
Okay, ma'am.
We are going to have any different, yeah, you'll be seeing it in the different graphs as well. Yeah, so who is going to explain this one now? It's much clearer now as well.
Yes, ma'am.
Yes, ma'am. Can I try?
Yes, please. Who is this, Paras?
Yes, ma'am.
Yeah.
Ma'am, the first.
This is very clear, visible. So you're going to explain all the things.
Okay, ma'am. This is vesical pressure, and
this is it.
During and this is
now look.
below.
Yeah. Now this part of the graph till here. Just like till this line, till if you can see this voiding shows that this is the voiding phase, and before this all is the filling phase of the graph. Filling phase of the maturating cycle, or if we say this graph, so we are talking about this graph, so it is the filling phase for this graph. This side is the filling phase and this side is the voiding phase.
Okay, ma'am.
Yeah, so now?
Ma'am, yes, ma'am. During filling
phase, detrusor pressure is also raised
along with abdominal and bladder pressure.
So, what type of incontinence it is?
This is
Bladder.
Ma'am, bladder pressure is rise and detrusal pressure is rise, and abdominal pressure is also rise.
No, but if you look at the abdominal pressure is not rising that much, you know. If you see, this is the
slight.
Yeah, it's just if you see at this is much, but if you see just, it is only this one, just a slight rise or a little rise in the
abdominal pressure is not rise.
Yeah.
Okay.
But if you see the detrusor pressure, again, the detrusor pressure is rising.
Rising during the filling phase.
Yeah.
During the filling phase, and there is no leak. It is.
It's overactive bladder.
Detrusal overactive.
Detrusor overactive.
And ma'am, voiding is not bell shaped.
Voiding is not bell shaped.
Bell shaped, not bell shaped.
Normally it should be bell shaped, but in this case, she is having this incontinence. That is why the curve is not a normal curve.
Okay.
Okay, and the flow rate is also more. It is 38 m.
It should be.
Ideally, it should be more than 15 ml per second. Clear to all of you, this graph?
Yes.
Yes, ma'am. Now understand.
Normal.
Yeah.
15 ml per second is the maximum flow rate, or it is the normal?
Sorry, can you please repeat the question?
My question is that if the flow rate here mentioned is 38 ml per second. So when you showed us the previous slides, the flow rate was supposed to be 15 ml per second, right?
More than 15 ml.
Max, more than 15, like it should. Okay.
Ma'am, it is the rinse.
So whatever the value is, if it is
25?
more than 15 ml, that is normal, no matter what the value is. So that is okay.
Yes, that is normal. Bell shape uroflowmetry with a peak flow rate of more than 15 ml per second.
Thank you.
So I'm just going to quickly again tell this graph. This graph, if we divide this graph, This is showing the vesical pressure. This is showing the abdominal pressure. This is the detrusor pressure. This part of the graph is showing as a filling phase. The voiding is showing us the voiding phase of the cycle of the graph. Now we can see in the picture, in the filling phase of the cycle, the bladder pressure is rising. The vesical pressure or the bladder pressure is rising. We can, and normally the bladder pressure should rise in the voiding phase, and we can also see that the abdominal pressure is rising in the filling phase, but it's very slight or it's very little. Can we have everyone muted, please?
In this, there is no detrusor activity, almost same, constant. But there is abdominal and vesical pressure that increases with the cough, and there is a leak. I'm Hamida.
Yes, please.
And I
please.
just want to clear my concept that in dynamic stress incontinence, there won't be any activity of the detrusor. Only the rise will be in the abdominal and the intravesical pressure.
With leak of urine.
And with the leak of urine.
In the filling phase of the cycle.
Yes.
Ma'am.
And the detrusor overactivity, there won't be any, there will be a detrusor overactive activity in the filling phase, and that will going to do the leak.
Yes, along with that, there will also be rise in the bladder pressure also.
But the abdominal pressure won't increase.
Ma'am, can you please explain this graph again?
Yes, sure. If you look at this graph, this is the detrusor pressure, this is the vesical pressure, and this is the abdominal pressure. And this whole graph that is made is in the filling phase of the cycle. When we see this graph in the detrusor pressure, there is only a slight increase in the detrusor muscle. Otherwise, in the whole filling phase of the cycle, there is no increase in the detrusor pressure. Okay. Now, when we come to the vesical pressure, you can see that the vesical pressure is rising. You can see it here. And when the patient coughs, the vesical pressure is rising here also. Now, when we come to the abdominal pressure, we can see the abdominal pressure is rising. With the vesical pressure, the abdominal pressure is rising. And when the patient coughs, the bladder pressure, the abdominal pressure is also rising with the vesical pressure. In the filling phase, when it happens, that the bladder pressure is rising along with the abdominal pressure, and the graph shows that when the patient coughs at this point, there's a leak as well at the same time.
So
but there is no change in the detrusor pressure of the detrusor muscle. The detrusor pressure muscle, it remains same throughout this filling phase. It's almost constant or steady throughout the filling phase.
So if we have to diagnose as a patient, then we will tell the patient got stress incontinence, but when we see the graph, then we will going to tell it's an urodynamic stress incontinence.
Excellent. Would you like to read the detrusor with the other graph as well, just to clear it for yourself?
Yes, ma'am. Also explain this graph, please.
Yeah. I'll be repeating it again. No worries. If you see this graph is divided into two halves. One is the filling phase. Till here is the filling phase, and the pressure that is measured from here till here is the voiding phase of the side graph. Now, these are the this is the vesical pressure, this is the abdominal pressure, this is the detrusor pressure, and this is the flow rate of the urine. Now, in the abdominal, in the vesical pressure, what we are seeing that in the filling phase, the pressure of the bladder is rising. As you can see from this graph that it is rising, and then it is coming back to its normal. Now in the abdominal, when we come to the abdominal, you can see that the abdominal pressure is constant throughout, but there's a slight increase in the abdominal pressure in the filling phase. In the voiding phase, we can see that the bladder pressure is rising. Because the bladder is voiding, the urine is passing, that is why the pressure of the bladder is rising, but the abdominal pressure is same. Now when we come to the detrusor muscle, detrusor pressure in the filling phase, the pressure of the detrusor muscle is also rising. And
but ma'am, it's more rise during the filling phase. During voiding phase, it is not increasing as much as during the filling phase.
Yeah. Because we need to see it in the more in the filling phase. Now our concern is mainly in the filling phase.
Okay.
So we can see, and in the voiding phase, we can see that the flow of the urine is also increasing. Because there definitely urine is passing, the flow of the urine will increase, the volume of the urine that is passing from the urethra is going to be increased. So in that case, it is more than 15 centimeter of water peak flow rate. That is 38, which is given here.
Can I say something here?
Yes.
Can I add something? Well, I just want to say something in simple Urdu.
Yes, please, no problem. Yes, no problem. But I can't hear you. If you can be closer to the mic, please.
I just
Really
wanted to add this simple thing कि किसी चीज को खाली करेंगे तो pressure कम ही हो जाएगा ना.
No.
Void
Yeah,
कर रही है वो.
exactly.
Madam,
Yes. Yes. और जब हम भरेंगे किसी चीज को,
it is
I may not be proper
filling
in my
phase.
Urdu. Sorry for that. I may not be proper in my Urdu. But हम जब किसी चीज को भरेंगे, so it will start to rise. It will start to rise in the filling phase. जब बलून के अंदर हवा भरेंगे, तो उसका pressure बढ़ेगा.
Madam, physiologically in filling phase, abdominal and vesical pressure will increase, but no increase in detrusor pressure. And
Yes.
if there is any stress and leakage of urine during filling phase, it is urodynamic stress incontinence. And if all three pressures rise during filling phase and that lead to leak without any stress, that is detrusor overactivity. Am I right?
No.
For the detrusor activity, no, you are not right. I would like you to repeat this point again for me, please. In the detrusor overactivity, the name itself says detrusor. So you need to don't even memorize it. Detrusor overactivity, the pressure of the detrusor muscle will rise. Along with that, the pressure of the bladder will also rise. But there will be no change in the abdominal pressure in detrusor overactivity.
And also doctor, it will lead without any stress, right?
Yes. Because the name stress incontinence itself suggests stress, like stress in the form of coughs, sneezing, laughing.
No, I'm talking about I'm asking about the detrusor overactivity. In the detrusor overactivity, the pressure of bladder increases along with pressure of detrusor increases, right?
Yes.
But
yes.
But urine leak without any stress.
Urine may leak or may not leak. If urine is going to leak, you are going to call it wet detrusor overactivity. If there is no leakage of urine, then you will going to call it dry detrusor overactivity.
If there will be no leak in dry detrusor overactivity, then how we will diagnose that it is detrusor overactivity?
There is going to be rise in the detrusor pressure and also the vesical pressure.
Ma'am, patient symptom will be urgency?
Yes, urgency, nocturia.
Nocturia, okay.
Frequency.
And we will diagnose it on the basis of graph only.
Yeah, right? On the basis of urodynamics.
Okay.
The basis of urodynamics, we are going to diagnose it. All clear?
Yeah.
Yes, ma'am.
Okay. So just a few questions to make sure that you all have understood it clearly, or you just need a bit of revision for it. So who's going to take the first question?
Shall I take now?
Who is this?
Shaista.
All right, Shaisa. Yes, please go ahead with the question.
A long history was given of urinary symptoms, including incontinence. At the end, giving a urodynamic chart, simultaneous elevation in abdominal pressure, vesical pressure, and leaking with cuff. This is stress. This is it's urodynamic stress incontinence.
Urodynamic incontinence.
Yes. So which option from this?
E.
E. Yes.
Urodynamic stress incontinence.
Yes. This is going to be urodynamic stress incontinence. But you need to see if there is also a very option close to it, stress incontinence. Sorry, this is my writing mistake. That it's just my typing mistake. That urodynamic is stress incontinence, and there's also an option of stress incontinence. So you need to check that. At the end, it was given as a urodynamic chart. It was the last question of my EMQ paper. My paper 2 EMQ question was this, and I took almost 15 to 20 minutes to solve this question. 2 EMQs simultaneously. And it was horrible for me when I saw those big graphs. On each single page, the whole options were there, and a graph on next page, a graph on the next page.
Oh, but
really very horrible experience for me.
Because of
I did it.
Yeah, but now our concept is clear because of
that's what I thought. I did also study it, but I did not thought it will be such an important case. But now we've understood, and it has been now coming in frequently in the questions after that. Because in that, the urodynamic chart was also there. But actually, I did not remember exactly what that chart was. But it was pointing out towards urodynamic stress incontinence. And there were many options, many more options were also there. Who's going to read this question for us in a loud voice so that everyone can hear it?
Okay, may I?
Yes, sure, please.
A 53-year-old woman with symptoms of leakage of urine on coughing and sneezing. She's also complaining of frequency and urgency, but no urgent continence. Urodynamic studies show a bladder capacity of 450 ml. The bladder is stable throughout, but leakage is observed with cuff test without a detrusor contraction. Which of the following is the correct diagnosis? The bladder is stable throughout. Okay, here the bladder capacity is reduced, and there's leakage with a cuff test without a detrusor. It says urodynamic incontinence.
Mixed urinary incontinence.
Urodynamics mixed incontinence.
Patient has urgency also, but no urgent continence. So that's mixed. Yes, urodynamic mixed incontinence.
Why mixed?
Because there is urgency also. She has complaint of urgency also. Okay, but it is without a detrusor contraction. So no, that is a urodynamic stress incontinence. Sorry.
Yes, exactly.
So confusing.
Yeah. Look, that is why whenever a patient comes with the complaint, we have this confusion. That is why we go for the urodynamics study.
Okay.
Because patient has mixed complaints. From the complaints, we can either take it as a stress incontinence and also as a overactive bladder. But when we combine both of them, it becomes mixed incontinence. That is why we did for her, this patient, the urodynamics was done. In the urodynamics, what we saw that there was a leak in the urine with a cuff, but there was no detrusor muscle contraction.
So this will be urodynamic
stress incontinence.
Ma'am, bladder capacity is also reduced. Is it significant? 450 ml.
Urodynamic bladder capacity, if it decreases, yes. Bladder capacity, if it is less than 500, if it is less than the normal capacity of the bladder, then we term it as sensory urgency. But in this, there's no any option of sensory incontinence, sensory urgency. There's nothing mentioned like this in the options.
Okay, ma'am.
Okay, clear?
Yes, ma'am.
Yeah, thank you. Who's going to take the next one now?
Yes, ma'am, I will take.
Okay, sure. Hope this graph is visible.
Yes, ma'am. This is visible. Ma'am, in this graph, the upper one is a upper abdominal pressure, and below this is a vesical pressure, and then a detrusal pressure. During filling,
this line shows that this is the filling phase, and this shows the voiding phase.
There is no rise in abdominal pressure, and vesical pressure is not rising, and detrusal pressure is also not rising. It's
Detrusor pressure is rising in the filling phase. You can see this whole graph is the filling phase. This whole graph is the filling phase.
Okay. Yes. Then both pressures are rising, vesical pressure and detrusal pressure, while the abdominal pressure is not rising. And if both are rising and leak, there is no mention about the leak.
Because so that is in the below line that you can't.
Yes, I can't see the below line.
Just because just because of that. Yes. Otherwise, below there's a leak as well.
Answer is A.
Yes, excellent.
Overactivity.
Because why?
Because there is a rise of vesical pressure and detrusal pressure during filling phase.
Exactly. And excellent.
There is no rise of abdominal pressure.
Yes.
So it's on graph, so we will say detrusal overactivity.
Yeah, exactly. Shaista, Sarish, Rutaba, Twinkle, all of you are correct. Hope you all are learning from this. Yeah, urodynamic stress incontinence, overactive, detrusor overactivity. It's not simple overactive bladder. So do we have any other questions before we end the session? Just few questions were there. They were these all are questions from the recalls that I took them.
Asha, excuse me, I have a query.
Yes, please.
मुझे पता है कि ये voiding phase में तो patient is already urinating. This the last question that you showed, right? Patient is already voiding in a voiding phase. So we are diagnosing the detrusor overactive void. So
sorry.
No, its whole is filling phase.
This is the filling phase of the cycle graph.
Hello.
How can we know when the
how
voiding
do we know that it is filling phase or voiding phase?
It is always written in the question. It is always mentioned in the graph that it is the voiding phase of the cycle or it is the filling phase of the cycle. Like in that question, if you see this graph, it is always mentioned. You're going to see in the graph that this is mentioned as voiding. So it means that this part of the graph is the voiding phase and the remaining part is the filling phase of the cycle. When you, I'll be sharing few of the graphs in the question.
Okay,
ma'am, yes, then we will familiar with the graphs now. Actually, always there are different type of graphs now. So I think we should practice more and more.
Yes, definitely. If you have also any graphs that you are unable to understand, you can post it in the group and we can discuss it. You know, anytime, whenever you guys are free, just post the question in the group and randomly we'll be discussing those just to clear it out. It's a very simple and a basic topic. Just if we understand 2 to 3 like important points after it, you don't even need to revise it again and again. It's just done once it is done.
I have a question. If in the last question, if there would be an option of sensitive bladder activity, then the most probable answer would be that.
Okay. The
If there
flow,
was an option of
if the bladder capacity is reduced in the last scenario, which was saying, which was detrusor overactivity, in the question
yes,
answers which we done.
yes,
If there would have been another option, which you were saying that the fifth option, in case of bladder capacity is reduced, that is the sensory bladder activity or what you were telling.
yeah,
Kindly just
sensory incontinence. Yes,
sensory
then my
incontinence.
mind could have gone up. Then my mind would have think of that option as well. But in
Which
this,
would be the better option in that situation if the scenario is the same and we have that option as well.
yes, look, if there is going to be sensory incontinence or sensory urgency, what happens is that the whole of the urodynamics study will be normal. Only there will be decrease in the bladder capacity.
Okay.
So even if the question was same, but there's if leak was also not there, like leak was also cancelled from the question, only bladder capacity was reduced, then definitely my answer would be sensory urgency.
It has to be normal urodynamics study.
Yeah, normal
Because in case
urodynamics
of
with just a
dry,
decreased bladder capacity.
as you were saying that in dry detrusor overactivity, we will not be having like leakage over there. Only the pressure
Yes,
will be rising. So in
yes,
sensory, the urodynamic studies will be totally normal,
normal.
except for the decrease in
This is
capacity.
the bladder capacity of the
Okay,
bladder.
I want to share. I also appeared in part 2. In that exam, in the second part of the exam, in EMQs, there were
Yes.
3 to 4 questions, which were all of urodynamic studies. And
Yes, sir. If I
but there
have.
were no
This was
graphs.
also mine. Yeah, maybe there were no graphs from. Maybe there was little bit change because when I did when I appeared for the exam for my part 2, I had the graphs as well there. You know,
But there were
the
no
sim.
graphs, and
Yeah.
it was the last 4 questions.
Yes, yeah.
My
My two
mind
last
was
questions
shut.
of the exam, like question number 99 and question number 100. If I exactly remember those questions till now. They were
And
two questions of
I was just
urodynamics.
fighting with those questions, and I could not get it because I was tired. I cleared part one, first papers, EMQs and SBS, but not of the second part because my mind was not relaxed or something like that.
Yeah,
I
just
don't know.
because you sometimes get tired. No, definitely. Do you have the questions now, or you just post it in the group? We can discuss it there.
Okay, I'll post them in the group.
Yeah, and just tag me there in the group. I'm surely definitely going to answer it. We can discuss it tonight or tomorrow whenever you are free.
Okay, thank you.
Dr. Sir, I have a question.
Yes,
I
please.
just want to clear more concept about this. If a patient having detrusor overactivity with sensory urgency, you said there is a rise in PDAT and P vesicle. So graphical presentation will be normal urodynamics, and there will be just patient will complain about urgency, or there will be no leak. Obviously, can you clear it more because I'm so confused.
Okay, I'll repeat the points. If there is only urodynamic stress incontinence, there will be rise in the pressure of the bladder.
Detrusor. Okay, okay.
Okay, just to revise it quickly, just a quick summary of it. You know, if all of can be clear. In case of urodynamic stress incontinence, there will be rise in the abdominal pressure and the vesical pressure. Plus, there will be leak of urine as well. When we talk about detrusor overactivity, now detrusor overactivity, it can be wet, it can be dry. If it is wet, that means like pani hai, so that means it is incontinence, the leak hai. If it is not pani, that it is dry. That means there is rise in the vesical pressure and the detrusor pressure in case of detrusor overactivity. Now, when we talk about sensory urgency, whole of the urodynamics will be normal. No, there will be no any problem with the urodynamics. Only the capacity of the bladder will be reduced.
Okay.
Clear?
Yes, ma'am. But you said how to reach diagnose. Then there was a third point in which you write down that detrusor overactivity with sensory urgency. How to reach diagnosis in that? You said detrusor overactivity with sensory urgency.
So that is both.
Then rise in
yes.
PDAT.
Yes, that is detrusor overactivity along with sensory
It's
urgency.
sensory
This is
urgency.
both
Yes,
together.
yes, this is the thing. Okay, okay,
This is
okay,
both together. If it is only
okay.
sensory urgency,
There will
then
be
it
the
is
bladder
normal
capacity
graph.
will be reduced
Yes.
only. Okay,
Yeah, only bladder
okay.
capacity will be reduced.
Yes, that is the thing that I want to confirm, that if there is detrusor overactive with sensory urgency, then graphical presentation will be just like detrusor overactivity, but there will be no leak, right?
Yeah.
Or there will
There
be
will be
okay.
reduced
It depends.
capacity.
It
Capacity,
depends.
reduced capacity with it.
Yes,
Okay,
capacity will
okay,
be
yes.
reduced, but for detrusor overactivity, there may be leak or there may not be leak. But
May
for
not be leak. Okay,
yeah,
okay. Just got
plus
it. Got it.
minus,
Okay.
there's going.
Okay,
Yeah.
ma'am. Okay, got it. Got it. Yes,
Okay,
ma'am.
great.
Got it. Thank
Yeah,
you so
great.
much.
Ma'am, I
Yes,
have a
please.
request. Ma'am, can you show us the initial slides?
Sir, I have a question. Ma'am, in normal voiding phase, there is bell shape. In detrusor overactivity or in stress incontinence, what changes occur in voiding? What changes occur in voiding? What shape change?
There's no definitive shape. There's no definitive shape in case of when there's incontinence, either stress or active bladder. There's no specific shape for that.
But pressure increase.
Yes, pressure will increase. Either detrusor
Normally
muscle
more
pressure.
than more than 15 centimeter
Water.
more than water. Normally more than when detrusor overactivity or stress incontinence, there is also increase in widening pressure. So normally and in these conditions, pressures also increased or not?
Look, if it is a stress incontinence, the pressure of the detrusor muscle will not rise. It will rise, but it will be not rising. It will be no more than 15 centimeters. That means less than 15 centimeters of water in filling phase. And normally the shape is bell shape. Otherwise, we don't need to remember the shapes because they are different shapes and they have no importance in diagnosing the condition, whether it is urodynamic stress incontinence or it is detrusor overactivity.
Okay. So please go next.
Thank you.
Thank you. Hope you all are clear. Any further questions before we end the session?
Excuse me, ma'am.
Yes.
If bladder capacity is low and nothing abnormal, everything is okay, only in scenario they are showing decreased bladder capacity. So we can say that this is poor compliance.
This is sensory urgency.
Okay, ma'am.
When only the bladder capacity is reduced, everything is normal. That is, it is sensory urgency.
Right.
Yeah?
Ma'am, can you explain about low compliance bladder?
Low compliance, that means it is the compliance of the bladder. That is the function of the bladder is not, it's not working properly.
Means it's different than.
It's different than from sensory urgency.
Okay.
In terms of graphs, we only have to identify 3 conditions. That is urodynamic stress incontinence, detrusor overactivity, or sensory urgency.
For sensory urgency,
for
like
part
in the.
2. Yeah. For the level of the part 2. But definitely it was going to be the urologist and further studies, definitely they need to know everything. But at our level, we need to know this much only.
Like in the last question, it was also bladder capacity was also reduced. So if there is option of sensory urgency, can we choose that one? In this
Yes,
question,
you can choose, or you can choose that if everything is normal, there is no leakage. It says, but leakage is observed with the cuff test without a, if there was, but there is no leakage, then definitely I would have chosen sensory urgency.
Okay.
Yeah.
Okay, that means in stress incontinence also bladder capacity can be reduced. Like in this question, it shows 450 ml.
But if you see in this question, there's not a much bladder capacity is reduced, just 50.
Yeah, not much. Yeah.
You know.
But it's less than 500, so.
Yeah, It's less than 500, and we don't have any other option to choose for. If you don't, what other option you would have chosen from these options that are given to you?
Can I add one
Ma'am,
other
if we
point
have
in
an
it?
option, ma'am.
Hello.
Yes.
I'm not 100% sure on it, but let us further see and tell that somewhere I've read that it is 500. That capacity is 500, but 400 to 600 is considered as normal range.
Yeah, it may be, slightly, there may be difference of the books, like what I have gone through my strategy, what the TOG article says, and what further studies that I have in part 3 also, what we have studied is 500 to 600 ml. So that is just the normal of the values, that slightly it can be different.
So maybe 450 is not that a low value.
If you consider, if you consider 400 to 600, maybe if we see the FCPS books like Evidence Space or that, they may be having the reading of 400 to 600. I'll go back through those books also and will let you know. But when we come to MRCOG for the Royal College, definitely we have only the reference of the guidelines, the TOG articles, and the strategy.
Ma'am, then with this same scenario, can we choose urodynamic stress incontinence with sensory urgency, if there is option?
No. Because there is no option in this question. If there would have been an option, then definitely you could have chosen it at that time.
Actually,
so
this is
what could be the findings in sensory urgency on urodynamic graph?
The graph will be normal, only the capacity of the bladder will be reduced in case of sensory urgency.
Means about leakage, there may or may not be leakage.
No, everything will be normal. Only the
Okay.
sensation. The problem is with the sensation of the bladder. That is where the bladder capacity is reduced.
Okay. And can I add one more point?
Yes, sure, please.
Someone was asking like what happens to the voiding phase in urodynamic stress incontinence or detrusor overactivity. What happens? What change will be there in the voiding phase? What I'd like to say is that there are two parts in the graph: the filling phase as well as the voiding phase.
Yes.
This filling phase is something concerned with the storage function. And storage function is where you're concerned about the urodynamic incontinence, stress incontinence, or the detrusor overactivity with incontinence. So it is basically in the filling phase that you look for urodynamic incontinence or detrusor overactivity. The second half of the thing, that is the voiding part, it is something to do with other diagnoses like bladder outlet obstruction and things like that. So that part is for some set of other diagnosis.
Yeah, that goes up to the level of the urologist in it. That doesn't goes for us. Exactly, very right.
And also even in prolapse histocele, where you have in that, even that there will be a voiding dysfunction. The time of voiding will be increased. The peak flow rate may not be
along
attained.
with the prolapse, there can be stress incontinence. That depends about according to the patient.
Yeah. Okay, ma'am.
Clear to all of you? Shall we end the session?
Dr. Aksa, will you do with us the prolapse and the other thing?
Yes, definitely. I'll be taking whenever I just get my time, I'll just be having as you have asked me, so I'll be just sharing with you. Definitely, I'll be taking a class on POPQ classification.
So in that, along with both the scenarios can be combined, like urodynamic and prolapse, because sometimes the scenario comes with both the symptoms of prolapse as well as of the stress incontinence or other.
Surely, I'll do that. I'll put the questions together. And if you have any questions, you just also bring us to us in the group, so we can discuss those questions. I'll put in the slides and then we can discuss on that also, those questions.
Ma'am, I have a question.
Hmm?
How to diagnose mixed incontinence?
Yes. If there is going to be mixed incontinence, what mix of what?
Urgency and stressing, urge incontinence and mixed stress incontinence.
So in stress incontinence, what happens?
The bladder pressure and detrusor pressure increases.
So in mixed incontinence, this is going to be the same. Whatever you mix it. If you mix stress and detrusor overactivity, there will be rise in the abdominal pressure, there will be rise in the vesical pressure, there will be rise in the detrusor pressure. Because mix is always mix, all rise.
Okay, thank you.